So I'm sitting up here looking at an article, and I've been gone for a bit. And basically, I've seen plenty of articles, and some I've read, and some I haven't. Some I've just kind of glanced over. And I've really just been observant with the community in South Los Angeles, and I've been trying to see how people's reaction is with the news about the surge of COVID-19. And what I've witnessed is still a lot of people refuse to believe that it's real. And I believe it's because of the miscommunication and misinformation through some of the media. Um, if it's via social media, conspiracies, theories, people's ideas, um, and these are some of the things that I've heard people in the community say. Some people say they're very afraid and they're not going to send their kids back to school until there's a vaccine. These are various different things that I've heard people say, and these are parents. Then I've heard just regular people say that they're afraid that, you know, by them going to work, it could be their last holiday that they're ever going to be around because they could go to work and pick up the disease. They don't know who has it and who doesn't have it, so they try to do whatever they can to be safe as possible. Then I've heard people who said that they've come in contact with it or they've gotten tested positive with it, and they tried to do everything they thought they could do to be safe, and they still wound up getting the disease of COVID-19. And that was my son's friends from college said that they were doing everything that they were supposed to, um, and they still ended up getting it. But they're younger and they didn't die of it. They just had to stay home and quarantine. And so the worst part of it is over with, but they're afraid because they were positive for the virus. Then, in my travels, when I went to USC, there was an outbreak over by USC. So I've been over to USC quite a bit. I used to live over that way. Really not that far from, that area, but usually between USC and South LA area, Inglewood, Culver City. Um, so some people are really good about wearing some kind of face covering, and some of that I believe is just a habit, a force of habit, because a lot of the businesses request that it's mandatory and they require you to wear a face mask when you enter their public place of business because of the surge and the possibility of coming in contact with it. I've seen some places where they are, you know, setting up hand sanitizer and they have the cloth wipes with the alcohol, and you can wipe your basket off if you're going to go do grocery shopping. Some places have like a recording telling people to stand apart, not to mingle too close with other people that they haven't really been around. Then there's some places that are hard for you to distance because people are trying to get prepared through this Christmas rush. So some people are out shopping and they're trying to get through doing all of their holiday shopping. So you'll still see people wearing face coverings. They're trying to stay baskets apart from one another, which is probably about 6 feet or somewhere in that neck of the woods. And then you see some places that are closed. They're not open anymore. There's still some places that were doing outdoor dining. I think they told some of these places to stop doing the outdoor dining. Some people were still trying to have parties, but you don't see as many people there. So I believe there is some fear because now that the surge has happened because of Thanksgiving, I believe what has happened is at least every 4 persons has either come in contact with someone who has gotten sick with the virus or they know somebody who has said that they've come in contact with someone who may have been ill with it. And so that's probably why it's starting to slowly sink in, but not fast enough for some. Because you still have the conspiracy theories, that the ideas, the hard critics, and then the distrust of government and the distrust of media. And you had a president who was never really that persistent about wearing a mask, and I'm referring to Donald Trump. And he recently had a party, I think it was a Hanukkah party, and he had a lot of people gathering, and I don't believe that they all were wearing face coverings or masks. So it's as if he's kind of the leader still for some people's ideas and beliefs, and I I would say that is the reason why I believe more of the rural areas are now being affected, because I believe a lot of those areas in the rural areas that are being hit hard with this COVID were in doubt that it even really existed. But now that they have, I believe this is what happens when people start noticing friends or coworkers or somebody they know that knows somebody, or they know somebody themselves that has come in contact or been affected or died of it, then it begins to become more real. Um, and so in the Black community, I believe because of so much confusion, so much misinformation, fear, and distrust in government type situations like this, when you start talking about vaccinating masses of people, it just brings back memories of other incidences that were race based and targeting certain communities. And the fear that maybe the vaccine could have something in it to wipe out certain groups of people or populations. Because I believe someone had mentioned to me earlier in the week that there was someone that was going around killing homeless people, and it was because of the fact that they were homeless and they didn't have any money, or they didn't have any motivation to get up and do anything to change their circumstance. And so they were pretty much at the mercy of this individual who's playing um, the executioner, and pretty much punishing them for poverty or despair or whatever their ills or problems were. And so this person was going around murdering homeless people, is what this person was telling me. And so I believe they were hinting around that people are afraid that the vaccine could have something in it that could cause people to get sick, that may cause people to actually have a bad reaction, or there may be side effects, or it could be targeting certain communities. And there's fear of that. And that's the same thing that the Jewish community was concerned about with the child vaccinations. And so I understand all of that, and I could see how people, because of being in a community and being the target of racial oppression, could cause people to have distrust of government, um, or public facilities, because you fear that they specifically don't have your best interest at heart. And so I believe that has something to do with the reason why some people have kind of had this attitude where they've given up on these people who claim to be the cure all or the saviors of the communities, when the communities have seen so much failure in the past. And so I just wanted to say that before, because a lot of times I'll go into the articles and I'll read them. And, not everything that I read in the articles I agree with all the time. Um, Sometimes I do. I understand, I get their point. And then I understand that articles are part of media as well, and the news outlet, and sometimes they can steer people into certain ideas, but then a lot of times they can be informative and let you know what's happening in the world at the same time. So you have to kind of weed out the ones um, that are just focused on a specific political arena. And so I believe this one is basically it is NBC, and it says that we are not prepared. Vaccine buy-in among Black Americans won't come easy, experts warn. And so I believe they compile information from as many people that they could find that may have interest invested in certain communities. This one is in particular has to do with Chicago, I believe. And so I saw this article earlier in the week. It said that the patients who streamed into her clinic in a low income and predominantly black section of Chicago's South Side have been terrified by the coronavirus pandemic, said Dr. Brittany James, stressed out by its harmful effects on the community and frustrated by mixed messages from government officials. So this article is basically probably going to reiterate some of the things that I have been saying, and I feel like it's not just in Chicago, it's here too in California, in South LA, in the black communities. It's the same feelings. So it's shared. It's a shared frustration. But now, back to the article, it says just as possible solution to the virus spread is on the horizon, she is particularly worried about what she is hearing from her patients. So many of them fear that the vaccines aimed at stopping the spread of COVID-19 will be harmful to Black Americans. Concerns about the vaccine have left Black people entirely unwilling to take vaccines, while others have said that they want to wait and see how the first wave of vaccine distribution is handled. So when those concerns come up, I look at my patients in the eye and I say that I understand that I have read the studies myself, and my job is to protect you, and I will not do you wrong, said James, but a family physician who is also an assistant professor at the University of Illinois College of Medicine. I don't respond with writing them off as irrational and ignorant. So, as a result of her conversations with patients and her own medical experience, I'm already seeing the writing on the wall that we are not prepared to roll out this vaccine out to vulnerable communities, said James, who co-founded the Institute for Anti-Racism in Medicine earlier this year. So I feel like I am screaming into a void and trying to get people to understand that I can see that this will fail if we continue to do what we normally do with distribution. Over the past several months, as infection, hospitalizations, and deaths from COVID-19 continue to rise across the country, is having the harshest effects on Black communities like the ones James serves. So, by almost every metric, be it increased unemployment, diminished academic performance, or exposure to the pre existing conditions that put a person at a greater risk of getting sick, the virus and its economic fallout have often affected Black Americans more severely than other groups. So it's been very overwhelming, James said. The pandemic's disparate impact has fueled concerns that Black communities who among or along with Latinos, Native Americans, are among the groups most affected by COVID-19 are being left behind as America responds to the virus, and with several vaccines likely on the path to federal approval in the near future, ensuring that Black communities and other marginalized groups have access to treatment is something that medical professionals say is crucial to defeating this pandemic. But right now, the one thing that may be more important than getting vaccines in the hands of Black Americans is increasing their trust in the process that created it and in the medical system that has mistreated them in both the past and the present. So, generations of experimentation on Black Americans and dismissals at the hands of medical professionals have left many skeptical of the medical field and wary of taking this vaccine, something that just half of the Black poll respondents have said that they are willing to do. So it's all part of a cycle of distrust in the medicine that some Black medical providers say is both completely warranted and deeply concerning. So it is not paranoia, it is not the Black people don't get it, or simply uneducated and unintelligent about their health, James says. The reality is that their worries have been earned and will not be corrected until medicine, public health, and the government reckon, listen to that, reckon with the past and what has been done to Black and brown people alike. And so now, as the country deals with another deadly wave of coronavirus surge, and I added that in there, is what they keep saying it is, Black doctors and medical providers are taking key roles in doing something they say should have been done decades ago, working to build trust in medicine in the Black communities and acknowledging past harms, but increasing confidences in vaccines is just one part of the process they say must continue for years. So, Black medical providers aren't shocked. Polling of Black Americans reveals that months into the pandemic, there continues to be a deep distrust of potential vaccine efforts. A September survey of Black and Latino respondents published by the COVID Collaborative NAACP Unidos US found that while 55% of Black respondents knew someone who had been diagnosed with COVID-19, just 14% said that they believed that a future vaccine would be safe, and only 18% believe the vaccine would be safe. So a December poll from the Pew Research Center found that while 71% of the Black respondents knew someone who had been hospitalized or died of COVID-19, fewer than half Black Americans polled would get the vaccine. So basically, that's the article. There's a little more. The Black medical providers, these numbers are stark, but not surprising. So we saw early on that the vaccine acceptance and willingness to enroll in the vaccine clinical trials was going to be a major challenge, said Dr. Reed Tuckson, a former public health commissioner in Washington, D.C., and a leader of the Black Coalition Against COVID-19, D.C.-based effort to spread information about the virus and potential vaccines to the Black Americans. So over the past several months, the coalition has worked with a number of Washington community organizations, historically black colleges, universities, community leaders to share information, both locally and nationally, about COVID-19 prevention, and drafted a public love letter to Black America that calls for people to be open to vaccines when they are available. So much of the organization's national work has revolved around combating misinformation and potential vaccines, and the coalition has used radio campaigns to further its reach. So the coalition has also worked to make experts available to the general public through remote national town hall and forums, including a recent event that allowed people to hear directly from Dr. Anthony Fauci, and the nation's top infectious disease expert and the director of the National Institute of Allergy and Infectious Disease, National Institutes of Health. So Tucson said that the events have largely been a success, adding that the coalition's first two town hall events reached about 240,000 people. Among Black Americans, there is a hunger and willingness for information and to engage in these issues when they are presented with the community's issues in mind, he said. So other members of the coalition include the presidents of National Medical Association and National Black Nurses Association, and the leadership of the nation's four historically black medical schools: Morehouse School of Medicine in Atlanta, Howard University College of Medicine in Washington, D.C., and the Meharry Medical College in Nashville, Tennessee, and the Charles Drew University of Medicine and Science in Los Angeles. And so the individual groups within the coalition have also worked to spread information about the vaccine to the communities they serve, and the four medical schools have been involved in the clinical trials process, but these efforts have at times drawn a backlash from alumni and other Black Americans worried that the process would somehow be unsafe. The doctors argue that their actions will ultimately help Black communities, so we've been developing linguistically, culturally appropriate materials to help people to get access to testing, educational materials about COVID-19. Dr. Valerie Montgomery Rice, president of the Morehouse School of Medicine, recently told the Undefeated. Martha Dawson, president of the National Black Nurses Association, said that the efforts to increase openness to the vaccine in the Black communities must stem from a direct acknowledgement of the ways that Black people have faced discrimination in the medical field, and from an honest and open dialogue that does not dismiss concerns or fears about the vaccine, but instead addresses them clearly with information. Historically, there is a saying that when white people catch a cold, African Americans catch pneumonia, Dawson said. So she explains that any efforts to address the pandemic in the Black communities must also address what are known as the social detriments of health and the external factors, living conditions, and economic outcomes that directly affect a person's health and have played a role in the wide health disparities between Black people and white people well before the pandemic had began. So this pandemic should serve as a wake-up call for how fragile our healthcare system is and that there is room for improvement, she adds. So the scars of Tuskegee. So this is where it usually stems from. This is one major event of many, I will say. It's not the only. So the improvement isn't just limited to closing the disparities exacerbated by the coronavirus, experts say, but rather they also want there to be increased acknowledgement and awareness of the history that is widely known in Black communities and not always shared elsewhere. The history of how racism in medicine has left profound cultural and social scars on Black people and their communities. So the history begins with enslaved men and women being subjected to surgeries without anesthesia in the name of medical advancement. Men like James Marion Sims, who has been celebrated as the father of modern gynecology, operated on Black women unable to oppose the treatment Other stories include cases like the Henrietta Lacks, black woman who went to a segregated Johns Hopkins hospital for a cancer treatment in 1951, only to have her cells taken and used in medical research without her consent for decades after her death. So perhaps the largest shadow has been cast by the U.S. Public Health Service on syphilis study at the Tuskegee, which began in 1930s and continued until its public revelation in 1972. A study which has conducted or was conducted in Alabama with approval of the U.S. government tracked 600 black men, 399 living with syphilis, 201 without the disease, but did not offer any treatment, instead observing the men for decades as they struggled with their health complications related to this disease, infected others, and died. So the study did irreparable damage to the men and their loved ones, and according to the research published in 2016, scarred a generation with life expectancies among black men over 45 falling in the years immediately following the revelation of this experiment. So the scars of Tuskegee and the other historical traumas continue to resonate today. Several black medical providers said the help and help explain part of this distrust in the black communities have towards the medical field. But another factor is that it also significant is how people have been treated in the present. And an issue is that has been exacerbated by the ongoing pandemic. So black people can't even get an adequate health care and access to insurance, Dawson said. So noting that even the black patients can access doctors, they report having negative interactions with them and are not always taken seriously when raising concerns about their health. So when there isn't a pandemic, if you don't allow me to fully participate in the healthcare system, then why in a pandemic are you expecting me to participate in the healthcare system? She added. So that's the questions that are raised. So we can't keep having it both ways. So the medical providers all acknowledge that the mistrust and the misinformation that they are seeing are issues that can't be resolved overnight and won't be fixed in the weeks before vaccines begin to be made available in the frontline public health workers, a key group exposed to the virus. But they also acknowledge that the cost of doing nothing are significant, could lead to further devastation of black communities. So Dr. Leon McDougall, a black physician in Columbus, Ohio, and the current president of the National Medical Association, notes that one piece of misinformation he wants to correct is that COVID-19 is only threatening to the older patients. So during a recent interview, he recalled the story of a 35-year-old patient, a former Division Division One football player who needed weeks of treatment for COVID-19, followed by months of dialysis for kidney failure. So prior to his illness, he looked like the Incredible Hulk, McDougall said, but he points to the case as an example of the ways that COVID-19 symptoms can linger for months after the treatment. So McDougall, who leads a task force of black physicians that plans to independently vet potential vaccines, also cites the case as an example of why vaccination will be important, noting that avoiding the vaccine could make racial health disparities worse. Because of this, McDougall said it is crucial for him to lead by example. So he said that he has signed up to participate in clinical trials for the vaccine and that he would take a vaccination when it's available. So he had said that he hopes that this pledge, coupled with the similar pledges made by other black doctors, nurses, researchers, and pharmacists, can help ease suspicion of COVID-19 vaccines. So Tucson of the Black Coalition Against COVID-19 is more direct. So the African American community needs to understand that the 2020 is not 1930 or 1940, he said. So there are no African American physicians or scientists or health policy leaders in the past. Today is a different situation, he added, noting that a series of ethical guidelines in the medical or medicine known as the Belmont Report stem directly from Tuskegee experiment. And so he also said that the numerous black scientists will have a direct involvement in the creation of a vaccine, including black women like Dr. Kizmekia Corbett, a lead coronavirus vaccine researcher at the NIH. So for James, the Chicago doctor, the only way that the vaccine conversations will change in the black communities is if the black people not only play a role in creating a vaccine, but they also are given lead roles on sharing vaccine information with the public. So we need to listen to black and brown leadership, places like black churches, nonprofits, and understand the communities, she said. So we need to empower them with resources to execute and follow their lead. So that is the article. I know it was lengthy, but it basically talks about us being prepared about this vaccine being rolled out. I think as soon as today, I believe is what I heard. But now I don't know how this is going to go in whatever order. Could be different. I'm hearing that it's going to be nurses and doctors, healthcare workers that are going to be the first ones or first recipients of the vaccine, and then it'll be like uh, available for emergency use for patients who are in like critical need of it. And I believe then elderly people who are at high risk. Then on down the line, it goes probably the frontline workers, other than just the nurses and doctors, like firefighters, police officers, people who are city workers, people who are doing services to the community, and then essential workers, people who are providing goods and services to the community. And then you're going to have also probably teachers in there, people who are educators, people who are doing services to the community are the ones that are probably the first in line that will receive it. And then communities on down the road will be communities that are really vulnerable, which will be probably communities that are hardest, that have a high surge, and then communities that are really vulnerable, that have, all this doubt where you have some people wearing masks, some people are not wearing masks, they're spreading. You have some people spreading it. You have people that there's high poverty, and like, when I drive up and down some streets, you'll see homeless people who are not really, some will wear masks and some don't wear any masks. And they're just out there around, walking around, exposed to everything. And it's like they don't care. And so, too, I believe some people look at that and they say, well, you don't see them getting sick. Um, Some people, I think their body is different than others. Some people can have something and carry it for a while and maybe not feel any symptoms. Because they did say there are some people who are symptomatic. Then there are some people who, as soon as they get sick with something, it just takes them out and they're in the hospital. So everybody's body's not the same. So maybe what one person can tolerate, others may not be able to be as fortunate to just be walking around and be unaffected. And then they said there's some people who have mild symptoms. They could have a cough. They may have COVID, but they have the milder symptoms of it. And so maybe they don't believe it because they think it's not that bad. But for somebody else, it could be really bad. Um, so I don't know what you think about it. What do you think? How is it in your community? Do you think that people believe it, don't believe it? mixed messages are being sent, that it's, some people still think that it isn't real, even though you have all this death. But I will say this: I have been seeing more people looking more like they're starting to get the picture, but it's scary. Um, I think how I see some people afraid is that they notice that a lot of businesses are closing, and that scares people to see businesses that you thought were never going to close, or they were always there and they're closing for good. They're closing their doors for good. They've been affected. Um, or places where somebody had gotten infected and they had to close the business because of that, because there was an outbreak. And so there's been a lot of that has gone on. And that happened to me recently. I went to one place and I was assigned to a workplace. And as soon as I got there, they were closing because a staff member, had gotten infected. The second place I went to, I was there for about almost 3 months. It was closed because a staff member went to Vegas, came back, didn't quarantine all the way, and so they had a scare that, you know, two staff members may have come down or come in contact with the virus. So we then immediately all had to be tested. So that was scary. So I've had two episodes of that. And then the workplaces, it's not guaranteed that, like, if you get sick or you get ill, it's not guaranteed that you'll be able to sue if you're put in a vulnerable position. And I've been put in a vulnerable spot on more than one occasion, and it's sad because I'm one of them that are. Okay, I'm in South LA, and I don't live where I can separate, just social distance from my family. And there's enough of us that if one of us comes down with it, all of us will get it. So that's why it's imperative that I stay safe and do all of the things that I need to do to the hand washing and wearing the mask. I try to do that as much as I can. But the problem with it is that the people I live among in the community, you don't see that much of that going on. Um, every now and then you'll see people that are their faces covered, or they're taking it serious, and there's certain ones that are taking it serious, and then others that just they don't take it serious at all. I've even heard people coughing. They're coughing, walking around coughing, and I'm sure that they probably come in contact with the virus. So we're living in close proximity of those individuals, and they refuse to wear masks. And so that's the scary part when you're living in communities where people have doubts or they have disbelief. They also they know that they might be sick and they expose others even though you're not wanting to be exposed. And so it's unfair. And so what do you do in those situations? And so you do the best thing you can do. You try to stay safe as much as possible. Um, so having said that, I know this is long. Um, I just wanted to mention that because I've been gone for a while. I've kind of, relaxed. I kind of gifted myself a little bit on another book. I got this book by Michael Eric Dyson called A Long Time Coming. It's actually in Target. Um, it's called The Reckoning with Race in America. And so, and then I'm still reading The Room Where It Happened, John Bolton, and he was a national security advisor for Donald Trump. He was working with Donald Trump, and then he resigned. So I'm just, I've been concerned. There's been some concerns about where this thing is going. I got two emails of local pharmacies that said they would, as soon as they had the vaccine available, that they would let people know who are able to come in and get the shots. and I believe there's 2 doses that has to be taken. I think some medicines are different though, because I was hearing one of the medicines is Pfizer, and then the other one is Moderna, and then there's different companies. So I don't know if it's one dose or 2 doses. I heard 2 doses. So I guess you get one shot and then you have to come back the next week or something, or the next couple of days. I don't know how that works. So I'm sure we'll be hearing about it really soon. And I think people want to wait and see what the side effects are, what people go through, how people, as more and more people get the vaccine. Some people are like that. They want to see what people's reactions are. How do they feel? I know I saw some symptoms where, for some people, if there were side effects, it was sort of like when you get a flu shot. You might get the headache, you might get a fever, um, you might have a little bit of pain at the injection site. And so, when you get a flu shot, that's the same types of symptoms. Then I heard some people get more, like, more headaches than maybe another person. So we'll see what happens. Everything is different. Like I said, everybody's body is different. And so I hope this article, it kind of mentioned, I thought this article was important because it mentioned a lot about why some people have doubts about the vaccine, or they have doubts about this whole thing in their communities and how they feel about it. And so that's probably explains why you see some people will wear masks and others don't, because they don't have any faith in the medical field because of the past, um, the past hurts, the past pain, the past discrimination, and the things that have happened from some of the stories that I mentioned from this article. So anyway, this I think this is a December 11th, 2020. It's at PR Lockhart. So having said this, I'm gonna let this video go. Some people I wanted to mention, famous people, recently passed away. Tiny Lister. It said he had COVID complications. He played in the movie Friday. He played as a wrestler with Hulk Hogan. Some of you might know who he is or know of him. I know I've met him on a number of occasions. Very polite individual. Um, when I've met him on every occasion. Um, I met him. As a matter of fact, I even thought about a time where in the '90s I met him. I forgot about that. But it came up again. I remember I met him in the '90s. Then I met him more recently in a barbershop. I would see him a lot in the barbershop. Um, and he was always addressed me as ma'am. He always did that. He was really nice. A very polite individual. And people would always ask him to do his they would always ask him to do his his version of Friday, and look menacing. And sometimes he would do it for some people, just for fun. But anyway, there's Natalie Desselle. It wasn't COVID. It was what the Chadwick Boseman passed away from is colon cancer, and she played in with Halle Berry in I'm trying to think of the she's been in Set It Off. She played in Baps with Halle Berry, and I thought that took me, wow. I was like, no way, these people are so young, why, you know. Um, I believe she's 53. I believe Tiny Lister, his situation was supposed to be COVID complications, and he's like in his early 60s, 62, I believe, if I'm not mistaken. That's what I saw they had listed. And then Charlie Pride, one of the first black country singers or artists that I recall. he passed away from COVID, and he was 82, I believe, and I saw in an article. But it is affecting the Black community, and recently Ashanti just posted on her Twitter account that she has tested positive for COVID-19. So it is real, you guys. So we have to come together and we have to collectively work as a unit and try to talk to, like it says here, to leadership that is among us that we can trust, that we feel that is giving us relative and safe information, and if we see them um, taking medication and they there's no harm in doing that to keep yourself safe, then maybe we should consider it. Because if we just walk around sick with something and then it gets worse, that wouldn't be good either. So, just out of fear to walk around, it's like you've been diagnosed with something and you know you have it or you know you could have it, but you refuse to get help. And so that's what it feels like. And having said that, I'm going to let this video go. Like, comment, subscribe. And thank you for listening. So as I let go of this video, if you look at this article, what it's saying here, the deadliest, I believe, I don't know if this is related to COVID. I thought I saw something that was related to COVID. It said the deadliest place in America. They shrugged off the pandemic. Then their family and friends started dying. And so this was in the rural areas. And so this was in the rural areas where people thought the COVID was not like Kansas, that it wasn't an issue. And so I'm not going to read that article, but I'll let you see the beginning headline, the deadliest place in America. They shrugged off the pandemic, then their family and friends started dying. And I believe this is a place where probably most people weren't wearing any protective. They weren't doing anything. They were acting as though there was no pandemic. And they knew that it was supposed to be spreading and that it was there, but because you can't see it and you didn't see anybody getting sick, you just kind of went on and did things as normal. And then they started seeing friends and family and friends started to die of the sickness. And so I feel like in the Black community, if we just pretend like it's not there, that's not going to make this problem better either. So having said that, I'm going to let this video go. Like, comment, subscribe, and thank you for listening.